Working for a company that supports being green is very important.
For me to know that my company is willing to invest this money in me, it just makes me want to perform better.
We're doing this because at Aetna we believe that this is the right thing to do.
At Aetna, we're focused on building a healthier world. That means doing everything we can to keep people healthy, to keep communities healthy. And it means doing the right thing for the right reason. Our strong sense of social responsibility is part of who we are. It compels us to innovate in many different ways and develop solutions wherever and whenever we can. Let's take a look.
In the city of New Haven, like many other urban metro communities around the country, we have high rates of asthma, particularly for children, and particularly for children, who are persons of color and those who are lower socioeconomic status.
I was about 2 when I was diagnosed with asthma. The thing that I didn't like is when my summer camp went to the trampoline park, I wasn't able to play because I kept needing my inhaler.
The Healthiest Cities and Counties Challenge is a very different approach than the traditional kinds of health improvement initiatives that you may see in a community. One of the big goals is to actually identify best practices within each of the 5 broad domains addressing the social determinants of health.
We learned a lot of things that were helpful. One example was when you have an asthma camp for kids, you want to open it up to their siblings because that actually helps the parents as well. Some of the outcomes that we want to be able to track is vaccination coverage rates for children of asthma, because children who have asthma, as well as other children who have chronic conditions, are at higher rates of flu complications, including hospitalizations.
We're going to identify these best practices that we will be able to scale and spread across the U.S., and we'll be able to accelerate the change and move the needle. So we're really excited about that.
In value-based care, the focus is really on the individual. It allows us to emphasize personalized health care, and it creates opportunities for better coordination of care among all the providers. Today, about 45% of all of our payments to providers on behalf of our members are value-based reimbursement.
We have the opportunity to really make a difference and fix healthcare so that it's a great customer experience, so that patients can get care when they need it, and that they get the right care, and that we do it in a sustainable way over time.
The physicians are starting to see that there's an inherent difference in the manner in which their patients are behaving and how their conditions are improving.
Some of my diabetes patients that I never thought would get to goal are hitting their goals.
Every participant in the health system shares the same goal, which is to make sure that those that we serve are as healthy as they can possibly be.
In January of 2015, we announced 2 new programs to improve the financial health and security of our employees by improving wages and improving healthcare benefits. Building on that, we're tackling the next big issue in this country, the rising cost of education and student loan debt. Student loan debt is a significant issue in this country, and we have an opportunity to ease the financial burden and stress on our employee base.
Students who have graduated since December of 2013 get $2,000 a year of loan payments, matching what you pay, up to $10,000. It's huge for me because when you go into your first career, I know that it's something on top of mind for a lot of early in career graduates like myself. Taking 1/3 of the balance off of my student loans definitely expedites my home buying process by years, at least 5 years.
Our programs help to make our employees healthier, happier, and more productive, which in turn allows them to focus on what matters most, helping our members achieve their optimal health.
Sometimes it's hard to know how you can do your part to help the environment. Buying an electric car is one way that you can help the environment, save some money, and Aetna supports it. Having a charging station at work was very important in my decision-making process to decide to buy the car. I drive 32 miles to work, so it's good to know that I can come and charge my car while I'm at work and have plenty of electricity to get home.
We work hard to build the health of the communities where we operate. Reducing our carbon footprint is an important part of that vision. We've launched a number of green building initiatives to reduce our waste, minimize our emissions, even reduce our water consumption. We also generate 2.3 million kilowatt hours of electricity through renewable energy solar arrays.
To me, it's important to work for a company that's socially responsible. I think we all want to do our part, and Aetna definitely makes it easier for us to contribute.
We're very proud of what we've been able to accomplish, whether it includes reducing our emissions or adding electric vehicle charging stations so our employees can live their own green lifestyles.